Welcome to Sexology, a podcast that untangles the science of sex and pleasure. And now, with this week's episode, your host, clinical psychologist, Dr. Nazanin Moali.
Good morning and welcome to another episode of Sexology Podcast. I'm your host, Dr. Nazanin Moali. I'm in my office this morning. It's another beautiful day in LA, and I'm super excited about my conversation with our guest today. We're going to talk about a topic that many of you guys requested, which is erectile dysfunction. And when you guys requested this topic, I immediately think about Natalie. I attended her presentation a few months ago at Center for Healthy Sex, and it was full of great content. So I'm super excited that she accepted my invitation and joined us today during our interview. We explore some of the main causes of erectile dysfunction. How can people improve their condition? What are some of the treatments? What are some of the prognoses? And what can you do to address this issue if that is something that you struggle with? And even if you're not necessarily experiencing erectile dysfunctions, but you have some issues around sustaining erection, this would be a great episode for you to kind of learn more about some of the tools that you can use. Natalie Finegood Goldberg is a certified Los Angeles sex therapist and licensed marriage and family therapist, specializing in sex therapy and psychotherapy with a subspecialty in erectile dysfunction. Working with individuals and couples, Natalie offers therapy services at her private practice in Beverly Hills, as well as running a healthy sexuality group for recovering addicts and alcoholics at Recovery Integrity in West LA. Natalie was formerly a clinical associate at Center for Healthy Sex in West LA, as well as having previously worked at Cliffside Malibu, a dual diagnosis inpatient drug and alcohol rehab. Natalie was born and raised in LA and is familiar with the variety of pressures that comes with living in LA. Without further ado, here's my conversation with Natalie. Welcome back to another episode of Sexology Podcast. I'm honored to have Natalie Finegood Goldberg in our episode today, and we're going to talk about erectile dysfunction. Natalie, welcome to our show.
Thank you. Happy to be here.
Thank you so much. I'm so excited to have you on this show. As I shared with you earlier, that I saw your presentation a few months ago on this topic, and it was fantastic and was full of great content.
Thank you. Thank you. I'm glad you enjoyed it.
Okay, fantastic. So I'm going to go ahead and going to ask about a few questions that I always hear my clients are kind of concerned. So I know one of your area of specialty is erectile dysfunction. So let us go ahead and start with kind of explore how do erections normally occur.
So an erection is a function of blood flow at its most basic level. When there is a combination of psychological stimuli and physical stimuli. When you're younger, you pretty much just need psychological, but as you get older, you need the physical as well. Blood starts to flow to the genital area, starts to flow to the penis, which leads to an erection. The smooth muscle accumulates the blood and it becomes rigid, and then, that is your erection, essentially.
And I'm just kind of curious because something that I hear from my clients a lot is that sometimes they say that they are psychologically aroused, but physiological arousal is not there. Is that something that's common for the clients that you see?
So this is one of the biggest misunderstandings about erectile dysfunction. Which is once a male reaches around age 25, which by all standards is relatively young, but like from an evolutionary standpoint, not so young anymore. When a male reaches around the age of 25, give or take 5 years, obviously, it's different for everyone. they start to require much more physical stimulation in addition to psychological stimulation. So, like, I hate to say it, but it's possible that gone are the days that just thinking about your partner turns you on. For a lot of men, once they reach that point, thinking about your partner might create some blood flow, but it may not be enough to create a full enough erection for intercourse or penetration. And so at that point, there has to be some sort of physical contact as well in order to get a hard enough erection to do those things.
So from what I'm hearing, it sounds like in most people, it's needs to be combination of both. So
absolutely, right. Yeah. I mean, particularly when you're no longer a teenager, basically.
Absolutely.
It's not enough to just think about the one that you lust after. There has to be some physical contact as well.
Okay. And I was just curious that I hear sometimes some of my friends, some of my clients, they're kind of confused about what is erectile dysfunction. What are some of the criteria that someone needs to meet in order to be qualified for that diagnosis?
Yeah, so, it is one of those things where the term gets thrown around a lot. If somebody is unable to get an erection once, they may freak out, oh my God, I have erectile dysfunction, oh my God, what do I do? And the reality is like most things, just because you have a bad day doesn't mean you have depression. So, the criteria, according to the DSM at this point, is that 75 to 100% of the time, so the majority of the time, you must have difficulty getting an erection, maintaining an erection, or maintaining an erection long enough to complete sexual activity. So for most of my clients, I ask them on a scale of 1 to 10, how often is this a problem? And if they say, for every 10 times that you have sex, 7 of them, it's a problem, then we're talking about legitimate, diagnosis criteria. If they say, well, it's happened to me once. How many times have you had sex? Oh, probably 30. Then it's not necessarily the full-on criteria for the diagnosis.
Absolutely. Yeah, 75% is like significantly higher than what people think.
Right. For the official diagnosis, it is a really significant amount. That's not to say that it's not incredibly distressing for men when it happens once. So obviously I am happy to work with those men and help them, but I think for a lot of them, it's very normalizing to hear, this is common, this isn't a significant issue until it's happening every time or almost every time.
And one thing that I often hear that some people are confused about is that do you need to be struggling everywhere? Like, meaning that when you're masturbating and when you're with partner, or if you have issues with your partner, only like a sustaining erection with your partner, still it is an erectile dysfunction.
So, according to the DSM criteria, they say complete sexual activity, which, could be interpreted either way, whether that's by yourself or with a partner. It's a question that I always ask because oftentimes what can happen is if the person is having difficulty with masturbation in addition to partner-related sexual activity, then it's often an indicator that something organic might be happening. Whereas if they don't have the problem while they're masturbating and you add in the element of a partner, there's usually an element of some of the psychological pieces of performance anxiety or if there's anything relational happening that's interfering with their arousal. So it's a question that I ask more for not necessarily, or more for like the diagnosis or diagnostic purposes to better understand like what are the factors contributing to it. But as far as, as far as your question of, does it require having a partner or not? It's sort of, hard to say.
Yeah, absolutely. I get that. And I think it's a good segue to the next question that I had in mind, that what are some of the physiological and psychological things can cause someone that cause someone to kind of struggle with erection, because I know there are a number of things that can play into it.
Right. So the main or the primary physiological ones are anything that relate to either blood flow or nerve functioning. So that includes things like diabetes. If you're diabetic, you're at significantly higher risk for erectile dysfunction due to the potential nerve damage. And then the other ones are like heart disease, hypertension, high blood pressure. Those are all, strong physiological factors that will contribute because they affect blood flow and like the quality of your blood transportation as well as your nerve endings. The other piece is medications. There are a lot of medications that interfere with sexual functioning. Lots of antidepressants, some of the hair regrowth medications, even like allergy medications. So these are all things that can interfere on a physiological level. In terms of psychological, the primary psychological one would be anxiety, but depression can also certainly interfere. Performance anxiety and generalized anxiety tend to impact erections the most.
I see. And one thing that I see that can be very, very frustrating is that I think sometimes when you tell people like there are some psychological component to it, they hear that's not real. I feel like sometimes some clients I work with, they kind of prefer if it was physiological. And I say, no, I talked to the urologist, nothing is wrong. And it's just so hard to kind of think about like psychological reason can significantly improve your sexual functioning for many people.
Right. And I think one of the things that's so frustrating about it is if it's not physical, then it means I can't take a pill for it. I have a lot of clients also that get referred from urologists, and the urologist will say, well, here is Viagra or here is Cialis. You can try it and see if it helps, but I'm telling you there's nothing physically wrong. And so they'll try it and it won't help. And they'll be very frustrated. And so, and then it leads to even more, oh my God, what's wrong with me? I'm even taking these pills and it's not helping. But the interesting thing about those, from what I understand, for what urologists have told me, is that if your anxiety level is high enough, it will override any of those medications. So, if you are really high anxiety, then first and foremost, the work is going to be reducing the anxiety, and then those medications can do their proper job.
Absolutely. Yeah. It's very challenging to kind of get into sexual mode when you're very anxious and in a fight and flight like kind of mode.
Exactly.
And one thing is that what I see from some of my clients, especially their partner, is that they get very frustrated. They see the issues around erection. They think that their partner is no longer attracted to them, and this can turn to a very vicious cycle that impacts their sexual life and also their relationship. What is your experience with that?
So it depends on what stage the relationship is in. For most new relationships, I often find that it's actually the opposite. Usually the man is so anxious about pleasing their partner and coming off as a good lover, that, their anxiety gets high. And so that tends to be the source of the erectile dysfunction, the performance anxiety. So if the relationship is very new and it's early on, usually I like to educate people that it's very much the opposite of educate the partner that it's very much the opposite. And that it probably has more to do with their level of sort of overexcitement versus underexcitement. There are some cases where, where it is true that maybe for some reason they're not attracted or, they want to make it work, but it's not the right fit. But more often than not, it has more to do with they really do like the person and they're just sort of overwhelmed by that feeling.
Right.
As the relationship progresses, then it can be more of a case of sort of a lot. I don't want to say necessarily a loss of interest, but I think what I see more often is a loss of communication. Because early on there is so much excitement, there is that psychological excitement that helps boost everything. And so, we come back to this idea of needing more of the physical stimuli in order to get an erection. And so a lot of couples have difficulty making that transition into, okay, like the initial dopamine rush is gone. How do we continue to keep this exciting? And oftentimes that includes more physical stimuli, but A, a lot of men don't know that, so they don't know to ask for that. And B, it's a shift in like the sexual script. And so it takes talking about. And again, like if you don't know that you need that, then you don't know that you need to talk about it.
Absolutely. And I think the education, as you were talking about, it's very, very important because, again, people may think that, okay, my partner is not attracted to me anymore, or I'm not as pretty as used to be. And that's why he's not experiencing the erection, or it's not as spontaneous as it was.
Exactly. And then it may cause the partner to withdraw or, versus moving towards each other and talking about it and discussing. And again, like if a man doesn't know that this is sort of how his body works, if he expects it to work otherwise, then he might withdraw also. And that will sort of further the issue.
Absolutely. What are some of the common patterns that you see that erectile dysfunctions, issues around erections impact couples' relationships?
I mean, some of the most common dynamics are either early on, like I said, sort of the level of overexcitement, and so difficulty or fear of wanting to get into a new relationship for fear of it happening in the beginning. And then, some of in the more long-term couples, just difficulty getting or maintaining an erection. And then the other thing that I do see a fair amount of, which is a little bit controversial at this point in time, is sort of the pornography piece and how that affects erections. At this point, there are studies in both directions saying that pornography does affect erections, and there are studies saying that it does not. So there's no definitive answer just yet. But in my own practice, I do see a lot of partners who, whether it affects their erection or not, it affects their sex life. With one partner, if the sex isn't satisfying, or not even if the sex isn't satisfying, just the element that like watching pornography is easier. It's a solo act. It can be done whenever you're ready. It can take as little as 2 minutes, or you can, depending on how much free time you have, you can indulge for longer. But I often see that sort of creating a wedge in partners' sex lives.
Interesting that you said you kind of aware of the studies on both sides. So I hear oftentimes like the negative side, because it's more just present that like if people do compulsive masturbation, obviously there's nothing wrong with indulging on like regular basis, but people who engage in kind of obsessive masturbation and how that might impact their sexual functioning. But what about the other side of the studies? How can that enhance the relationship?
Well, so some of the studies on the sort of pro-pornography side talk about, there's one study that talks about just the increased use of visual sexual stimuli, i.e. pornography, increases a person's sexual appetite in general. And so the belief is just sort of the more sex you're having, whether it's sex with yourself or not, will increase your sexual appetite. And so that study found that there was no effect on erectile dysfunction, because these were people who were also having more sex with their partners as well.
So it's kind of make it more present in people's mind.
Right.
Okay.
Right.
Okay, so I'm just kind of curious about, because I know my listeners, many of them, they're probably interested to learn about what are the treatment options? What are some of the, is it something that they can kind of address and get treatment for?
So there is certainly sort of the medical options, which range from, and again, you'd have to speak to your doctor about this in particular, but some of those options include taking an oral medication like Viagra or Cialis, any of those types of medications. Sometimes hormones can be an issue. So if there's a testosterone issue, sometimes that might involve any sort of testosterone replacement therapy, which can be oral or like creams. And then there's also sort of at the highest level, most people try to use this as a last resort, but there are injections that you can take to create a full erection. So those are sort of the medical options. As it relates to the psychological options, obviously there is sex therapy. And I mean, at least from how I work, that can be, it's generally a combination of looking at your thought process around sex, your thoughts around sex, your expectations of yourself, your beliefs around sex, what you've learned, and sort of trying to re-educate the person if they've learned any sort of misinformation, like when they're 30, they should be able to get an erection just by thinking about it.
Right.
So there's this sort of cognitive behavioral aspect. But then there's also a little bit of a physiological component, particularly in terms of learning how to work with your anxiety. So I do some visualization techniques. I highly, highly recommend and encourage all my clients to get a meditation practice going. So certainly breath work is important, breathing. Learning how to get yourself out of that fight or flight state, because that is the antithesis of an erection, really.
Right.
So any physiological tools to help calm or soothe them or relax them, super important. Yeah, and I do a little bit of somatic work just in terms of like grounding and trying to, like I said, create some visualizations of moments when they're calm, moments when they feel confident, to counterbalance these moments of fear and what if, and particularly to help them be present in the moment. Another thing I emphasize a lot is, like I said, being present in the moment. So when we use the word mindfulness, it's a big buzzword right now. And so I try to explain to clients what I mean by that, which is I want them thinking about their five senses. So that means, like, let's say you're having intercourse and you start to lose your erection, rather than going into your head about, oh God, what's happening? What do I do? Or sort of all the what ifs. What if I lose it? What if it doesn't come back? I encourage them to get into their body and in particular into their five senses. So what am I feeling? What am I, literally, what am I touching? What am I smelling? What am I tasting? What am I hearing? What am I seeing? In order to get them out of their head and back into their body.
Right. And I think those are great recommendation, definitely mindfulness, because I think overall stress level of the communities and patient population we work with, and everyone is so high that impacts all aspects of their lives.
Right.
So I think definitely mindfulness can bring some additional benefit for clients as well. One thing that's interesting that sometimes I've noticed that my clients, as you were talking about, they're very kind of mindful of, they don't want to lose the erection. What if that is an issue and when it's an issue? And they kind of get to this fantasy world, which is absolutely okay, but then they're not in the moment. Mm-hmm. So they do opposite of what you're saying. What is your thoughts on that?
Those are certainly moments where I encourage the mindfulness piece, and part of that includes, really getting to know themselves sexually. And so, that includes really getting to know what are their turn-ons in the moment, not the fantasies about what if they think about they'll get turned on, but when my partner is right in front of me, what do I want to do to them? How do I want to touch them? How do I want them to touch me? How is my body most turned on by my partner? And starting to really develop some awareness around that. So, okay, let's say you're starting to lose some stimulation or some firmness in your erection. That's when you say to your partner, hey, could you play with my nipples right now? Or, hey, can you kiss my neck right now? So you can start to communicate about the in-person things that help you to feel stimulated, connected, and aroused.
Right. So kind of as you mentioned earlier as well, communication is so important. And I know many people are struggling to talk about sexuality and sexual related things. So right. I think if you get comfortable with that and have that conversation, maybe even ahead of time, that can change things drastically.
Right, right. And letting go of the expectation that just because we're having sex, you should be aroused on either end. It's really important to know that arousal oftentimes, particularly beyond the early days of a relationship, takes work. It takes effort.
Right, absolutely. And the other thing that sometimes I experience and I hear from my clients, from my friends, is that the one partner, there's an issue with that dynamic of the relationship. So the person is really into the other partner emotionally, in all aspects of life. But the sexual, there are some sexual struggles. And so I'm thinking about, in your practice, based on your experience, is that possible for people to kind of work on that and get some results?
Absolutely. Absolutely. There's a thing called a yes, no, maybe list. And it's a kind of extensive list. There's a few different ones of them, circling the internet if you Google it. And it's, this is one tool that I use, but it's a pretty extensive list of just various sexual acts. And I have each partner fill it out and check off, yes, things they're interested in, no, things they would never do, and then things that are maybes. And so one of the tools is I have the couple come in and we sort of compare lists and see things that are yeses or maybes for both of them. And we talk about them. And so part of it is, helping them to find some common ground, helping them to, connect sexually for some of the things that are maybes. If that means that they've never done them before, trying new things together can always create a new level of excitement. So, I think a lot of times what happens is that over time, when couples get in the routine of sort of the business aspect of the relationship, we own a home together, or we pay bills together, or we raise children together, you can get really focused on that and you start to see your partner only in that light and you forget that they're a sexual being. So part of it is just sort of unearthing, or not unearthing, but sort of reconnecting with the sexual aspect of the relationship and reconnecting with my partner as a sexual being with wants and desires, as am I, and starting to, like I said, reconnect on that level and talk about those things again.
Absolutely, kind of bringing some excitement and new ideas, because as you were talking about the education, unfortunately, many couples, many individuals, they think that their level of sexual arousal needs to be the same throughout different decades of their lives with the same partner. So it can be very empowering to see that not necessarily that's not the case, and what can they do to regain their sexual energy.
Right. And the other thing that you bring up, which is a great point also, is that particularly for long-term couples, people's bodies change over time. So, what may have worked a year ago, they may not be interested in anymore. They may have discovered this other thing that they really like. And if you're operating on the assumption of, oh, well, my partner really likes their nipples played with, but, what about tickling their lower back?
Right.
So there starts to be a lot of assumptions around how to be sexual with each other, and the sex can become routine as a result. So it is important to continuously check in about, what are your turn-ons and what are your turn-offs, because those definitely can change over time.
Right. As I'm hearing, it sounds like it needs to be an ongoing conversation versus once they're doing
Absolutely.
the exercise and using it as a template for decades to come.
Right.
How long does it take for, obviously it depends on the condition, but what is usually the course of treatment? You would say on average for someone who's struggling with erectile dysfunction? Because I know the reason I'm asking is people kind of want to come in once or twice and they think there's this sense of urgency. So I think it's helpful if we have some kind of framework.
It really depends. If it is a person who has never struggled with any sort of mental health issues and it is a one-off, they lost their erection once and they're really worried about it. Like I said, no mental health issues, no family history of mental health, no other real relationship problems. I've had clients who, 1 or 2 sessions of just talking about it and getting their information straightened out has been helpful. Sometimes that can take closer to 6 to 8 sessions. 1 or 2 might be an anomaly, but it can be closer to 6 to 8 weeks. Where it gets complicated is if, how long the person's been struggling with erectile dysfunction, sort of how deeply ingrained the negative thoughts or the negative patterns are. B, if they have their own mental health struggles, like if they struggle with anxiety in general, then it's a little bit more complicated. C, if there are any relational problems that are contributing. These are all things that will certainly extend the amount of time necessary to treat or address the issues.
Great. And I think that it is very important, as you said, that for people to kind of think about the issues around erectile dysfunction as a possibly multi-layer thing, as you were talking about. Maybe it's a relational, maybe it's physiological, maybe it's psychological. So it's very helpful for them to kind of if it's an ongoing issue, to get support around that.
Right. I mean, if this is something they've been struggling with for, 3 to 5 years, it's not going to go away. Maybe it will. It would be lovely if it went away in 6 to 8 weeks, but it's, it's tough to have that timeline.
Absolutely. I've noticed we are toward the end of our time, Natalie. I know you have your wealth of great knowledge around this area, and I bet many of our listeners would like to kind of reach out to you. What would be the best way for them to contact you?
So the best way to contact me is generally via email. My email is natalie@creatingchangela.com. That's LA as in Los Angeles. Or they can contact me through my website.
Great. I'll make sure I put both those information and show notes so people would be able to, if they're driving or they don't have time handy, they can get a hold of you that way. Thank you so much for your time. It was absolutely a pleasure, and I hope I will connect in future.
I look forward to it. Thank you so much for having me.
I hope you enjoyed our conversation and you were able to kind of pick up some good tips and tools on how to address the struggles you have around erection and erectile dysfunction. At the end, I wanted to talk about, yes, as Natalie was talking earlier, people's anxiety and depression can be cause of erectile dysfunctions, issues around sexuality, but equally important is how issues around sexual performance and erectile dysfunction can lead to low self-esteem, can decrease your quality of life. And I wanted to also remind you, sometimes it's very easy to address. So if you're struggling, if that's an area that you feel you need some guidance, it's good to reach out to a professional. Thank you so much for listening to this podcast. Appreciate if you show us some love by writing reviews on iTunes and subscribing to this show. I'm looking forward to talk to you next week. Have a wonderful week. Thanks for listening to the Sexology Podcast. For more great content, visit www.sexologypodcast.com. Please be advised that information presented on this podcast is not a substitute for seeking help from a licensed mental health provider.